Then there's the chance to practice in areas of care that are special to the Yukon, such as working in an expanded role in one of the territory's 14 rural communities. Today, it's not the isolated posting it once was, but the challenges and rewards remain the same.
Nowadays we have computer with 24-hour access, high-speed internet. We used to put a note up in the nursing station door saying where we were, you know, gone berry picking or out for a walk in the community or something, and somebody have to come and find us.
But it's changed now. There's 2 nurses in every community except for 2 of them in the Yukon. There's full-time clerks.
I wanted to try outpost nursing, and I moved up in 1997, and I absolutely love it. Probably because it gave me the opportunity to incorporate all the things I've learned over the years in nursing, and to be able to put it to practice and be able to operate the full scope of what I can do.
I've thought about being a nurse practitioner for a long time. I like the autonomy that comes along with it. I wanted to have a little bit more say in what I did, a little more freedom to paint my own palette.
We not only do all our own health assessments, we diagnose problems, we prescribe medication, and we suture wounds up. We take x-rays. We're also our own pharmacists, so we dispense our own medications. There's been a few times called where I've had to go out and do rescues on the land, so I've got to take the nursing station snowmobile and go out into an accident site. And there's no way in a hospital would I be able to jump on the snow machine and go deliver care on site 60 miles away.
I enjoy knowing the people that I work with, knowing that when this elder comes in, I know their background, I know their history, I know what's going on in their family. It's also about working with the community, like working with the First Nation wellness worker and the Director of Health and Social Programs. Old Crow's got some real nice charm. The people are very welcoming. There's lots of activities to do. Not only were we invited to things like dinners and dances and community events, it was it's sort of an unspoken expectation that the people like to see us involved, and that's a very nice expectation, to be welcome. People are very respectful of our time. In Old Crow, they know that when the nurse is out in the community or after hours, that's our time for ourselves. So we usually get phone calls after hours for emergencies, and it's expected, and that's part of my job, but usually the first thing that comes out of people's mouth is, "I'm so sorry, but," or, you know, "This time I really need your help."
As far as supports in the Yukon for community nursing, it's better than anything I've ever had. Here you have a spring and a fall conference. The room, the accommodations, the meals, the travel, your wages are all paid. Since I came to the communities, I have worked with absolutely the best nurses I've ever met. They're people that are mature. Doesn't mean they're old, but they're mature, and have been able to incorporate their personal practice and their professional practice. And it's really a joy to see people the way they grow.